Welcome back. We're here with the daytime veteran, Dr. Arun Narang. You are no stranger to the guest chair.
Right.
How are you, sir?
How
Thanks
you
for
doing?
having me again.
Good.
Good to see both of you.
Good. Well, we're going to take a little bit of a medical spin, it seems, in terms of what we're going to be talking about today in our teeth. Why don't you get things started for us?
Sure. I mean, a lot of times we're talking about procedures and, cosmetics, and I thought it would be good to talk a little bit about, your overall body health and sometimes the impact that, for instance, the link that we're finding between gum disease and heart disease or your cardiovascular health and gum disease and diabetes, and a little bit of an update on the use of antibiotics prior to cleanings or dental treatment that some people have to undertake.
See, I always thought, I never really thought there was a link, you said, even to cardiovascular problems as well as diabetes. I never thought about that. How can people at home stray away from gum disease leading to these health problems? Tips?
Well, people don't realize that, cardiovascular disease is the #1 cause of death worldwide.
Wow.
And all the studies, there's been a number of studies that have come out, and the most recent one was published in the New England Journal of Medicine that followed 120 people that had severe gum problems, but they were otherwise normally healthy.
Okay.
And then what they did was these people underwent intense scaling and cleaning of their teeth, and if they had any infected or bad teeth, the bad teeth were removed. And what they found out was that over that 6-month period, they had a tremendous improvement, a significant change in their blood flow and in their cardiovascular health.
Okay.
Wow.
So the studies are clearly pointing to a link between gum disease and heart disease. And what's scary about it is that 1 out of 3 people over the age of 30 in North America has some form of periodontitis or gum disease.
You mentioned one, periodontitis. Is that what you just said?
Yeah.
What's that,
Well,
doctor?
that's when the bone starts getting affected. So if your gums are just inflamed, we know it's gingivitis.
Okay.
When the bone starts getting infected, it's periodontitis. So, if you're getting more significant gum problems, in the there's 1 out of 3 people, like a third of our population.
That's
Pretty significant
staggering.
for people to become aware how important regular cleanings, by your dentist and or hygienist are, and visiting the dental office.
And what you're saying is, of those 1 in 3 people that have this kind of condition, whether it's periodontitis or gingivitis, they're more likely to have a cardiovascular disease impending.
There is going to be a component. There's a link that we're seeing.
There's a link.
So those people are at greater risk for cardiovascular problems.
Well, that's reason enough to keep the teeth clean.
Yeah, exactly.
Really, to avoid these kind of diseases.
Exactly. What are some of the signs of that you do have gum disease or that you are affected by this?
Well, bad breath, bleeding gums. You bite into an apple or you brush your teeth and you have bleeding gums, or bad breath, or mobile teeth, or the teeth are beginning to get a little loose, or so there's so many different warning signs that we have of gum problems. But the best thing to do is visit your dentist and a hygienist and let them determine if you do have any periodontal problems, and then they can create a regimen for you to try to maintain the health of your gums, so you're not at risk for developing problems throughout the body.
Well, Dr. Narang, we have about 2 minutes left. Why don't we talk about your teeth and your dental health and antibiotics? You said that there's a link there as
Two
well.
other things I'll quickly touch upon are, again, diabetes. There's a significant link that we're also finding between gum disease and diabetes, because people who have higher, who do have gum disease, have significally higher levels of, they're more insulin, they develop insulin resistance much more easily. They're twice as likely to develop insulin resistance, because what's happening is the chronic, the chemicals that are being released by the gum disease and the gum problems are getting into the bloodstream, and they're having an effect on cells that create then insulin resistance. So we've got to be careful of that. It affects diabetes too. So again, the gums are healthier.
Yes.
You're going to probably have better overall health and less chance of exposure to diabetes. And finally, just on the prophylactic antibiotics, many people who did used to have to take antibiotics prior to cleaning, if they had various heart issues like a heart murmur, etc., don't have to take it any longer.
All right.
You still do for more serious conditions like a valve, or somebody who had congenital heart disease, or somebody who's had infected endocarditis, but many of the things you don't have to. So check with your physician and or dentist, because you may qualify for not having to take.
You might have to take that. Well, Dr. Narang, thank you so much for joining us today. You're always welcome here on the guest chair. You can get more information on Dr. Narang on the board coming up, and we're going to prepare you for winter when we come back on Daytime. So don't go away.